Diabetes mellitus Y. Chronic kidney disease causes Y. Hypertension E. Chronic kidney disease causes Y. Nephrosclerosis E. Nephrosclerosis E. Chronic kidney disease causes Y. Primary glomerular diseases / that is glomerulonephritis Y. Chronic kidney disease. Kidney damage or decrease in glomerular filtration rate over a period of 3 months or more untreated leads to end-stage renal disease / ESRD. Kidney damage or decrease in glomerular filtration rate over a period of 3 months or more untreated leads to end-stage renal disease / ESRD. Chronic kidney disease. Elevated BUN and creatinine. Chronic kidney disease. Elevated BUN and creatinine. Kidney blood urine nitrogen 10 to 20 milligrams. D-li. Kidney creatinine 0.7 to 1.4 milligrams. D-li. Chronic kidney disease. Uremia. Chronic kidney disease. Oliguria and urea. Kidney anuria. Decreased urine output of less than 50 milliliters in 24 hours. C.
Kidney oliguria. Urine output less than 0.5 milliliters per kilogram per hour. Kidney anuria. Decreased urine output of less than 50 milliliters in 24 hours. A buildup of toxins in your blood.
Chronic kidney disease. Anemia.
Hemoglobin.
C beep C R beep C hemoglobin HBG sub hematocrit HCT C sub
Chronic kidney disease. Metabolic acidosis. Chronic kidney disease. Metabolic acidosis. Kidney 57.
Low bicarbonate levels, less than 22 mol/L.
Metabolic acidosis. Kidney phyllo 7.35-7.45Y. Kidney HCO3Y low 22-26Y. Low bicarbonate levels / less than 22 mol L.
Metabolic acidosis frequently accompanies the hyperkalemia.
Chronic kidney disease. YRR in depth.
Hey Siri, house fire increase. Compensation. Metabolic acidosis.
Increase RR in depth. Compensation. Chronic kidney disease. Abnormal phosphorus and calcium levels.
Hypocalcemia and chronic renal failure is due to two primary causes: increased serum phosphorus and decreased renal production of 1,25O2 vitamin D. The former causes hypocalcemia by complexing with serum calcium and depositing it into bone and other tissues.
Chronic kidney disease. Fluid retention. Chronic kidney disease. Electrolyte imbalances.
Hyperkalemia and hyponatremia. Hyperkalemia is a condition caused by excess levels of potassium. Normal blood levels of potassium are critical for maintaining a normal heart electrical rhythm. Chronic kidney disease, CKD, is frequently complicated with hyponatremia, probably because of fluid overload or diuretic usage. Dysfunction and potassium homeostasis. Hyperkalemia is a frequent finding in patients with chronic kidney disease, CKD. This increase in serum potassium levels is associated with decreased renal ion excretion, as well as the use of medications to reduce the progression of CKD or to control associated diseases such as diabetes mellitus and heart failure. Hyperkalemia is a common complication of AKI when the injury involves the late distal nephron and extends into the collecting duct, causing direct injury of cells responsible for K+ secretion.
Chronic kidney disease, HTN, chronic kidney disease, fatigue.
The pathophysiology of hypertension in CKD is complex and is a sequel of multiple factors, including reduced nephron mass, increased sodium retention and extracellular volume expansion, sympathetic nervous system overactivity, activation of hormones including the renin-angiotensin and S-aldosterone system, and endothelial.
Chronic kidney disease, fatigue. Chronic kidney disease, weakness. Chronic kidney disease, uremic fever/urine like breath odor, metallic taste in mouth. Chronic kidney disease, uremic frost. Chronic kidney disease, uremic skin colors. Complications of ESRD, end-stage renal disease. Anemia, Y erythropoietin production, short RBC life cycle, blood loss during age die.
Hey Siri, how spell decrease? Hey Siri. Hey Siri, how spell decrease? Hey Siri, how spell hemodialysis?
Complications of ESRD, end-stage renal disease. Bone disease, elevated phosphorus levels leads to decreased calcium levels, abnormal vitamin D metabolism.
Damaged kidneys must work harder to remove phosphorus from your body. Buildup of phosphorus is associated with less calcium in your blood and with the release of PTH by your parathyroid glands. PTH moves calcium out of your bones and into your blood. The loss of calcium can harm your bones.
Complications of ESRD, end-stage renal DC. Complications of ESRD, end-stage renal DC. Hyperkalemia, decreased excretion, metabolic acidosis, catabolism, excessive intake VDD. Complications of ESRD, end-stage renal DC. HTNO plus and H2O retention, malfunction of renin-angiotensin aldosterone seisme. Complications of ESRD, end-stage renal DC. Pericarditis, cardiac tamponade, retention of uremic wastes, inadequate dialysis. Hemodialysis complications. Hypotension, hemodialysis complications. Muscle cramping. Hemodialysis complications. Exsanguination.
Exsanguination.
Extensive blood loss.
Hemodialysis complications. Dysrhythmia.
The transition from high levels of toxins, electrolytes, and fluid in the blood to lower levels following dialysis can trigger arrhythmias, irregular and potentially dangerous heartbeats.
Hemodialysis complication C. Dysrhythmia, the transition from high levels of toxins, electrolytes, and fluid in the blood to lower levels following dialysis can trigger arrhythmias, irregular and potentially dangerous heartbeats. Hemodialysis complication C. Air embolism. Hemodialysis complication C. Dialysis disequilibrium Y.
Neurological symptoms caused by rapid removal of urea during hemodialysis. It develops primarily from an osmotic gradient that develops between the brain and the plasma as a result of rapid hemodialysis. Fatigue, mild headaches, nausea, vomiting, disturbed consciousness, convulsions, and coma. Range of neurologic symptoms.
Dialysis disequilibrium Y. Headache. Dialysis disequilibrium Y. Nausea and vomiting. Dialysis disequilibrium Y. Restlessness. Dialysis disequilibrium Y. Decreased level of consciousness. Dialysis disequilibrium Y. Sizer C.